So cataracts, what is it? To get there, I always like to start with where is it? And so I want to talk a little bit about the anatomy of the eye. The eye has something in it called the lens, and it sits, if you can see the focus on this photo right here, it sits right there. Or if I grab my model, you can tell it sits just behind the iris and the pupil right there. So if I remove the cornea, looking straight through there, and when I'm looking in a microscope, I can see this right through the pupil, and you can see the lens sits right there. And so what does the lens do? The lens focuses light on the retina. At least it's part of the system that focuses. And that little lens, if you notice, this one looks nice and clear. And that would be an eye without a cataract. A cataract happens though when this thing gets really, really cloudy. And when it gets cloudy, it obscures the vision, just makes everything really blurry. A couple of the symptoms you might notice is, besides blur, is difficulty in low lighting situations, whether it be you're sitting down to read, and even though you have a bifocal, you can't quite read the print unless you really crank the light up, or if you're driving at night, you might notice a whole lot of glare, and just general decrease in vision is probably the most common symptom. So how do they develop? Cataracts happen because they're made out of protein. Any type of protein, truthfully, they only do one thing, is that they go through a process called denaturization. And a denaturing protein, it's like saying it got cooked or it's rotten. And lenses, the lens inside the eye is no different. Over time, it gets cooked. And when these get cooked, they turn a yellowish brown, and they get cloudy. Some things that can cause cataracts, the most common things that causes cataracts would be just time. If you're alive long enough, you're going to get cataracts. There are some things that can accelerate that process a little bit, such as sunlight exposure, the UV specifically, certain medications such as steroids. Long courses of steroids can help make cataracts. Certain diseases and definitely eye injuries can cause cataracts as well. So to prevent cataracts, there's really no way to completely prevent cataracts. Like I said, if you live long enough, you're going to get cataracts. But some things you can help to slow it down is just keep your general health up, do the best you can there. Wear your sunglasses to avoid UV exposure. Wear your safety glasses to avoid trauma. Just do basic health things to help put it off. Having said that, some people get them anyway, and when eye doctors talk about cataracts, we kind of think, oh, no big deal. The reason we say no big deal is because it's very treatable. When you have a cataract, you get it removed by a cataract surgeon, and it's replaced with an implant that's nice and clear, and you can see again. Cataract surgery is the most commonly performed surgery in the United States, and so it's well practiced, and complications rates are very, very low.